Hello, my name is Dr. Gregory Krol. Welcome to Primary Care Snapshots for the Management of Chronic Kidney Disease, CKD. This is the first in a series of 5 short videos. They are designed to give primary care providers brief but pertinent management tips when addressing CKD in the primary care setting. The snapshots are intended as a quick and easy reference as you encounter CKD in your practice. Chronic kidney disease, or CKD, often conjures up images of complex and seriously ill patients. The diagnosis and management of CKD may seem at best involved. The reality is that 40% of all patients who have diabetes and 25% of all hypertensive patients will have CKD. This means, with a nationwide shortage of nephrologists, you will be managing the vast majority of these patients. CKD is associated with a 3-fold risk of death, so early identification is crucial. Let's begin by identifying prevalent at-risk groups you will see in your practice. 2 risk factors keep all patients at high risk: diabetes and hypertension. More than 70% of end-stage renal disease is attributable to these 2 diagnoses. Obesity, cardiovascular disease, and a family history of ESRD, particularly a first-degree relative, also contribute to increased risk. A frank and open discussion about addressing and altering modifiable risk factors must be initiated with your patients. Early intervention with high-risk patients also means engaging in patient-centered education. In the case of diabetes, approximately 95% of management depends on the patient's behaviors. Adult learners want information that is pertinent to their particular situation, so give them information that is targeted at their specific risk factors. Yes, it can take additional time and patience to encourage people to participate in their own health management. So take every opportunity to review information. Ask what they recall from previous visits and how they acted on information. Did they actually change any behaviors? If so, what and how? If they did not, why not? Last, support them with positive reinforcement for changes they made. Early identification of high-risk patients, along with early intervention, slows progression of CKD. Slowing CKD progression can indeed improve outcomes. In this series, we will review laboratory interpretation and diagnostic tips, medication considerations, and recommendations for seeking a nephrology consult. I'm pleased to say that later in the series we'll have a short consult with a nephrologist, my colleague Dr. Jerry Yee. I look forward to seeing you next time as I discuss laboratory and diagnostic specifics.